The interprofessionalism that you get from this school is really cool and unique because you get to see the different aspects from different professions, and they really teach you what each one's about and how you work as a team to care for the patient the best.
My master's training has extensively shaped my educational and career goals, I would say. So as I'm graduating, I plan to pursue a PhD in my field of study.
For an international dental student, it's one of the dream programs to get into. But even as a dental student, in India, I have referred to a number of publications by our alumni like Dr. Barji, Dr. Diogenes, Dr. Ruparel, and never in my wildest dreams did I think that I would be working with these amazing people one day.
I came in knowing that I had an interest in leadership, but not having the experience or the resources to kind of guide me or know what to do with it. So the biggest thing that I learned here is advocating, the leadership side of it. Time management was huge. I feel like it kind of rounded me out as a person, like a holistic. I was able to do volunteer activities and be involved in organizations and get experience in leadership roles.
My most rewarding experience here is building patient rapport and treating all of my patients at the dental clinic. I have gained many friendships as well as great patients that will hopefully follow me once I graduate.
During my doctoral capstone experience, I've been able to be a TA for the first year OT students pediatric class, and it's been really cool to get to implement all the knowledge that I've learned and kind of turn around, teach that material and mentor some of the classes behind me.
When I got with my first patient and as I progressed through my clinical rotations, I had all of these moments of understanding all of these things that were so abstract came to life in front of me with these patients, and I thought I would be more scared, but I have been found to be really proficient and knowledgeable among people that I look up to in this field, and it's incredible that I can convey that to them because of the knowledge that I've been given prior.
Being my PI's very first graduate student, I was able to record the very first spectra for our laboratory, and thinking about my future career, I can only imagine how excited I'll be if I ever get that opportunity. So I'm really privileged to be able to have had that opportunity with my lab.
My favorite memory going to UT Health San Antonio was my community health clinicals, where we would go to a vulnerable population here in San Antonio. For me, I went to a senior center down South San Antonio, and we interviewed the members of that senior center on what they would like to learn more about. I know for me it was diabetes and arthritis, so my team created a PowerPoint about that, and we taught them. We did health screenings, we did a lot of education to that senior center. Just feeling that sense of accomplishment that we really helped them and understand more about the diabetes and arthritis and chronic health conditions.
My family is my inspiration. I am constantly surrounded by individuals that are dedicated and persevere in all that they do, and they never lose sight to help others, which are things that I carry into all of my endeavors.
What inspires me most about being a medical laboratory scientist is that there's so much that you can learn about a patient from just a small sample, and the results that we obtain in the laboratory play a crucial role in a patient's treatment plan. And knowing that I get to be a part of that and make a difference makes me feel good about what I do.
It inspires me that the profession is kind of the first line for people when they're in a time of need. Most of the people that I've worked with would be humble about that, and they wouldn't toot their own horn about it, but I think it's pretty special for somebody when they're really struggling and they don't know if they're going to be okay to see an ambulance arrive at their house and some professionals with some awesome equipment there to help them.
It's kind of cliche to say, but my biggest mentor in my life by far is probably my dad. He's a surgeon here at UT Health San Antonio, and so obviously he's shaped my life in countless different ways. But I think more recently, really importantly, he's taught me all of the possibilities that a physician has for advocacy for patients on every different level, whether it's at the hospital or the department or even just a small service team, all the way up to the national level.
Mentors for me helped me really have a vision of what I wanted to be when I grow up, so to speak. And so viewing the mannerisms that different people would have in clinical interactions and the research setting, thinking how people think through problems and being able to pick those up over time And then also really having an ally who I could bounce my ideas off of and I knew was on my side to give me genuine feedback was incredibly valuable.
The benefit of having a mentor or a group of mentors is guidance. There's a lot of unknowns whenever you're starting graduate school. It's incredibly hard. So it's nice having the support and people to talk to and people to lean on, people to get advice from.
Just throughout my clerkships, all the attendings were so good about, getting to know me and where I wanted to go. I was kind of like a wondering person, didn't know what I was going to get into, so everyone was really good at just, sitting me down, talking to me, see what I wanted out of medicine.
I graduated from UT Austin, and going to UT Austin, I had myself and one of my classmates, Jesus Medina, who was like a brother to me, and we both got accepted into UT Health San Antonio. So I said, I know that it's a strong program, but it also showed me that they're selecting people of great moral character and so I'll have great classmates when I come in.
At the end of the day, you should be able to find something that, fulfills your purpose in life, something that makes you happy, something that kind of gives you the want to in the mornings, get you up out of bed. That's why I chose UT Health San Antonio.